Okay. Hi, my name is Christina Costa, and I'm going to inform my audience on my future career, which happens to be medical health services manager. Okay, so first I want to inform you guys on what the job description of the Director of Administration for a hospital, clinic, nursing home, rehab center, etc. I would be managing the entire facility. I'll be hiring staff, and I'd be making the hospital policies or the doctor's office or wherever I work. To be the director of the administration for the facilities, I'd have to have a bachelor's degree, and right now I'm working on my associates, so I would have to continue on with 2 more years of school. But I happen to know somebody that has worked her way up, which is Marianne, the one recording. She had worked 5 years in an HIV/AIDS facility, and she said it got boring, so she wanted something new to do. They trained her for her to be an HIV case manager, and she said that it's very stressful, but she makes good money doing it. This is just how mine is. They make very good money doing all of this. So, I want to pursue in this career because I have 2 children. Where I would start, because for the entry to mid-level management, I would either be in finance, nursing administration, medical staff relations, patient care services, etc. I found this information about where I would first start on a website for American College of Healthcare Executives. I knew this job that makes so much money, I wouldn't just make it from having an associate's degree, because a lot of jobs that you make really good money, you need to have a better education. I also found out on a blog on innerbody.com from Lisa Davila that the skills that you either need to be in the entry level or the mid-level would be problem solvers, leaders, motivation, communication. I believe I have all of this and more. I mean, I would put my all into getting this career because, you know, I have a family I need to support. I also looked up some information on excuse me, on the innovation of this career field, and there's quite a few things that I found out from my uncle. He told me new computerized medical records for access to patient needs. There's also apps that could be accessed through cell phones, tablets, etc. I know this because at my OBGYN, I could access it on my iPad, my test, what are those called? Test results? Yeah, test results. And I could fix my information if I changed my address or anything. Let me see. What else? Yes. Can you give me this one? I wanted to pass out some of this to you guys, just because it's required, and I want you guys to see some information. Just give me a second. Jeez Louise. You want to pass that way?
Thank you.
Welcome. There you go. Let me see. The first paper I gave you guys is the outline of the whole thing I was just talking about. And the second paper has to do with what I'm informing you now on about the innovation of the medical field. And this third paper is going to be about, it's a chart on how many jobs are going to be needed in this field by 2020. Right? That's what it says? Yes. That's it. Okay. What made me draw to this, to this career field was, in the beginning, I wanted to be a surgeon, an OBGYN. I wanted to work hands-on the patients. But one summer when I went camping, my mom's old best friend's wife fell in the fire pit, and she had severe burns, and she rubbed dirt in her legs, like on the burns, because to stop the burning. And we brought her to the hospital, and there was like a block that it was like rough texture, and the nurse had to rub the dirt out, and she couldn't have any medication because she had been drinking. So I don't think I would have been able to tolerate helping somebody but also putting them in pain at the same time. So I decided working behind the scenes would be better for me because I'm still helping them out even though I'm not hands-on with them. I know that this would be a guaranteed job because on the chart, the highest, which is healthcare support, which would be me, goes all the way up to 150. So that's from 2006 until 2020. If it can raise that high, I know I'm guaranteed to have that job. I already did that, okay. And I think that's pretty much it. I made it to 5 minutes and 6.
You're way over.